Thank you for choosing Ascension Saint Thomas for your spinal surgery. I'm Amelia, one of the occupational therapists, and today I'm going to go over with you what you can expect after surgery from a therapy perspective, as well as your precautions and any adaptive equipment that may benefit you. So after surgery, if your doctor orders therapy, you'll have an occupational therapist and physical therapist come see you. We usually come day of surgery or the day after, depending on how you're feeling. And at that point, we'll assess you, see how you're moving, ask you a couple questions about your prior level of function, your home, and we're able to make recommendations on how you can safely discharge home or to potentially a rehab pending your needs. So today we're going to go over some of the basics that we recommend for most people. The first is your 3 precautions after spine surgery. So those are no bending over, no lifting more than 5 to 8 pounds, and no twisting. Okay, so you can remember this with an acronym BLT, like a BLT sandwich, no bending, lifting, or twisting. So clearly that's gonna have implications for how you do your daily tasks at home, like bathing and dressing, as well as how you get in and out of the bed. So we're gonna start with teaching you how we want you to get in and out of the bed. So this is my patient here. Have her lay down. So when you're laying down to sitting up, the first thing we want you to do is bend your knees. If for whatever reason you can't bend both knees, it's most important that we get this back knee bent. Then I want you to roll all the way onto your side. You want to make sure that your shoulder and hips are all the way over, and at this point you're going to kick your legs off the bed. Perfect, and then from here we're going to push to sit up, and as you can see, her spine was nice and straight the whole time. All right, so when we're going from sitting to lying down, we're gonna come all the way down on to her side, bring her knees up, keeping them bent, and then from here, we're gonna roll back all as one unit. Perfect, that's what we call a log roll. So now we can come to sitting, we'll go over our hip kit equipment. So this equipment is used for bathing and dressing and enables you to do all of the things you need to be able to do without bending. Some people are able to bring their foot up to their knee. We call this a figure 4 technique. If this does not cause you any pain or any strain, then that's okay. But a lot of times, especially right after surgery, that can put a little bit of pressure, in which case we don't want to use that technique. So the first part of your hip kit is called a reacher. You've probably seen one of these before. They can help you pick things up off the floor that you obviously are not able to bend down at this point and get. We also use this for dressing. So I'm gonna have my patient here push her socks and shoes off. When you do your lower body dressing and you're using this equipment, I prefer that you do it sitting versus standing. Even if you have perfect balance, it can really challenge balance in a standing position, and we want to decrease fall risk in any possible way. So once you have your socks and shoes off using the reacher, to put them back on, you're going to use what's called a sock aid. So with the strings facing you and this open part up towards the ceiling, you're going to thread the sock on coming towards you. You want to make sure that it's flush and straight, so it goes on your foot straight. Then you put your foot in and pull it towards you, and it should slide right on. If for whatever reason it doesn't go fully on or it's not straight, you can then use the grabber to kind of straighten it out. Perfect. And then to do the pants, we are going to use the grabber as well. So you want to make sure that you get your pants in the right direction. You're gonna grab the outside edge with the grabber, kind of throw them out there and put your foot in. Then you'll get your other leg in. That's okay. And then you'll pull it up to your knees, and that's good. And then to push it off, you're just gonna use the grabber to push it off. Once you get it up to about your knees with the grabber, from there you can grab it with your hands without bending and stand to pull it up. And then to put shoes back on, you could use the grabber to move it to where it's in front of you. And then we have a long-handled shoe horn that also comes in the kit. This will enable the back of the shoe to not fold down on you. Perfect. All right, and lastly, we have a long-handled sponge, which you can use in the shower to reach your lower body as well as your back. We do recommend shower chairs as needed, depending on whether you have a tub or a walk-in, and if they're indicated. So that's something that your occupational therapist will go over with you after surgery. The last piece of equipment, this does not come in the hip kit, but this is something a lot of our patients find beneficial. It's called a bottom buddy. This is used for toileting hygiene because a lot of times being able to do that requires bending or twisting, which obviously we don't want you to do. So if you're struggling to reach to get adequately clean, we recommend using a bottom buddy to help give you a longer handle there. The last few things that you might need after surgery are a bedside commode and potentially some sort of assistive device for walking, like a rolling walker. This is something that both your physical therapist and occupational therapist will review and make recommendations on based on your needs and what equipment you may or may not already have. If you have any safety concerns after surgery, our job is to help you troubleshoot those. So that includes stairs in your house, your bathroom accessibility, your kitchen accessibility. So I encourage you to think about your home prior to surgery and any questions that you may have. Feel free to bring those to us after surgery. And we look forward to working with you soon.